The Make America Healthy Again agenda is all about prevention of chronic disease. It's not a new concept for primary care. Preventing chronic disease is really the cornerstone of what we do as primary care physicians and clinicians. It's our role. And that's exactly what we showed in the report, is what we know to be true as primary care physicians is what the data showed us. Cardiovascular disease is the leading cause of death in the U.S. for adults. The patients who had a usual source of primary care were more likely to get screening for the three major causes of cardiovascular disease: obesity, smoking, and hypertension. Adult patients who had a usual source of primary care were much more likely to get their cervical cancer screening done, their mammograms done, and their colonoscopies done. These are three of the most common cancers in U.S. adults. If we can screen for and catch these cancers sometimes before they start or at an early stage, we end up saving the entire healthcare system money, and we also end up saving lives. Although we know how important primary care is to preventing chronic disease, we only spend about 5 cents on every dollar of healthcare, or 5% of total healthcare expenditures, on primary care. Our report shows that only about a third of U.S. adults do not have a usual source of primary care, and about 12% of children do not have a usual source of primary care. So we have a large swath of our population that just does not have access to it. So for people who already have chronic conditions, primary care is important. Adults with chronic condition had 54% lower total health care costs when they had a primary care clinician, and for children it was about 40% lower total health care costs if they had a primary care clinician. For policymakers, it's really an equation. Do you pay for primary care now to save a lot of money in the long run, or do you not invest in primary care now and end up having to spend a lot more money on this population in the long run?
Primary care is the missing strategy in our comprehensive agenda to address chronic disease. We spend hundreds of billions of dollars on chronic disease as a country every year. We only devote 5% of our healthcare dollars to the specialty that's best equipped to address chronic disease, and that's primary care. So we, from a policy perspective, really need to shift our investment into primary care to improve our health outcomes and prevent chronic disease. Primary care is the healthcare sustainability strategy that we have got to make sure that we invest in, as opposed to subsidizing much more expensive care, both now and in the long run. Legislators and policymakers, the time is now. The primary finding of this report is that primary care saves money and improves health outcomes. The question really is not about whether we can afford to invest in primary care. It's about how we can afford not to invest in primary care.